Okay, I'll go ahead and get us started. So I'm Kim Porter. I'm the Executive Director of Be a Part of the Conversation. This is our 10th anniversary. We've been serving the 5-county area, meaning Montgomery, Bucks, Chester, Delaware, and Philadelphia counties for the last roughly 10 years. Thank you so much. We have a couple of folks with us tonight from Montgomery County's Department of Health and Human Services. One in particular is Neda Sultani. You'll be meeting shortly. I think we may also be joined by Lynn Moore Singleton. I'm not sure if she can make it or not, but she may join us a little bit later. But they are partnering with us to bring some really important conversations this year. So thanks to them and thank you for joining us. I'll also let you know that Judy Hirsch is with us. She is our Director of Community Engagement, and Judy and I will be checking the chat box if anyone has any questions, or you can put that in the chat or the Q&A, and we'll be checking that throughout the evening. So please do feel free to ask questions as we go along. We are recording this program. Only the panelists are going to be visible on the recording. Any questions that you ask will be private and won't be shown. We won't see your names or anything like that. But we just wanted to make sure that we were offering people an opportunity to learn about some of the resources if they weren't able to join us this evening. At the end of this program, you'll see a screen pop up that asks you to take a survey, and we really appreciate your feedback. Even if you've completed one of our surveys in the past, it helps us to know if this program was helpful and what you might like to hear in the future. And I just wanted to touch on a couple of programs that we have coming up next week. A week from tonight, we'll be hosting, this is also in partnership with Montgomery County as part of our Youth Marijuana Prevention Project. We'll have our Cannabis Who Knew program. And this is with a really terrific physician named Laura Offit. She specializes in adolescent medicine. And so she has a really terrific engaging style. And she has a website that is focused on teen health. And she's the perfect person to talk about this. And we'll be hearing from her as well as some people with some lived experience to talk about their history with cannabis use, which is not even remotely what it was even 10, 15 years ago. So a lot to unpack there. Also next week, we're going to be hosted by the Lower Moreland Township School District for a program called Isolation, the New Drug of Choice. And this is with Dr. Caroline Fenkel. Even though we're hosted by Lower Moreland Township School District, you're welcome to join us. You could register, I should have mentioned too, registration for next Tuesday's event is convo.zone/YMPP1. And the one on Thursday about isolation, again, this is focusing on young people, is convo.zone/isolation. And we'll be sharing some of those links in the chat as we go through the evening so you can get there easily. Also, you can always visit our calendar. That's the easiest way to find out what's coming up in the future. So on to our topic. I just want to give you a little bit of information that I think is pretty compelling and particularly for our topic this evening. So we'll talk a little bit about resources for those who are under 18, but also the adult population. And if we think about particularly those who are struggling with opioid use disorder, this was a study that was done just this year, taking a look at treatment retention and the reasons that treatment retention doesn't always happen. So you can see from this that about a third or more of people do stay in some kind of outpatient treatment for more than 6 months, which is really good news. Unfortunately, that's not always the case. And maybe 20% or so transfer out. That could mean that they're going to another level of care. But unfortunately, 24% or so drop out of treatment. Roughly 7 to 8% have completed early, or were terminated by the facility, perhaps for a policy violation, and some other reasons here, including incarceration. And of course, unfortunately, there are some deaths that happen while people are in treatment. And taking another look at who stays in medication treatment for opioid use disorder, these are different populations that they're looking at. So those who are more likely to leave treatment, so this red column are those who are more likely to leave treatment before 6 months, before completing 6 months of treatment, would be those under the age of 40 compared to those over the age of 50 who are less likely to leave treatment before 6 months. Homelessness is a risk factor, let's put it that way. Not being homeless is a protective factor. The co-use of methamphetamine with opioids will make someone less likely, more likely to leave before 6 months, as opposed to those who are primarily using opioids. They are less likely to leave. And then when you look at referrals, those referred by the criminal justice system, schools, employers, or the community, those folks are more likely to leave before 6 months than those who are either self-referred or referred by another person, presumably a loved one or friend. And unfortunately, we have probably 23, 24 million people in this country who have some sort of addiction to alcohol and other drugs. Of those 23 or so million, only 1 in 10 of them actually seek out and receive any kind of treatment. So 90% of our population who are struggling with addiction are not receiving treatment right now. And of course, all of this was really exacerbated by COVID. It's really increased isolation, which is why we're talking about this tonight. So there are different ways to access resources, and you're going to hear from some folks who this is what they do for a living, and they're so amazing in all of their roles. But just to quickly touch on those who are under 18, not everyone realizes there's a really terrific resource throughout the state of Pennsylvania called SAP, Student Assistance Program. So every public school, every K through 12 public school in the state of Pennsylvania is required to have some kind of student assistance program. So these could be referrals from family, from the students' teachers, peers, their own guidance counselors and things. And they often involve groups, peer-to-peer kind of groups that are led by a SAP counselor. And there are also opportunities through the guidance staff to access treatment. So these folks are very much aware. They are our allies. I know I'm a parent. I remember those days when my kids were, in the K through 12 system. We want our schools to see our kids as successful and the wonderful children that they are. But please know that they are also a tremendous resource for helping us to get services that we might need. They want to be an ally for our kids. It's not something that we should feel any kind of shame about, although it happens a lot. But please know that they want to help. They want to see our kids get the support that they need. So if we have someone who's over 18 who's struggling with substance use disorder, there are county case management offices. And I believe that Netta is going to be talking with you more about that, Netta Sultani from the county. But also just be sure to check with your insurance provider if you do have insurance to see what might be available. And for folks of any age, this goes not only for our loved ones who might be struggling with substance use, but for the family members as well. I'm the parent of someone in recovery. I know that Claudia Herman, who's with us, and Judy Hirsch, who's with us, we're all three of us certified family recovery specialists. And that means that we have been down this road with a family member, and we need help for us too. Sometimes parents in particular need to put the oxygen mask on ourselves first. And that might look like seeking therapy, especially if there's another parent who we're not on the same page with. It really helps to be with an objective professional who can help us to navigate these really challenging things. So, and of course, there's a lot of different kinds of treatment, inpatient being, for those who are really ready to dig in and take some time to heal and to recover and to dig into what's happening with this substance use disorder. And then stepping down from there might be a partial hospitalization program. That's typically a daytime, 5 days a week kind of program. An IOP would be a step down from that, meaning an intensive outpatient program. These are usually groups that meet 2 to 3 times a week. And then there's outpatient treatment. So that might be one-on-one, might look at a few different ways, but these are ways to just sort of titrate off, but also want to encourage people to think about lots of pathways to recovery. So, we have, of course, the tried and true 12-step programs, of which there are about 120 different kinds of 12-step programs, AA being kind of the first one out of the gate 85 years ago. But there are also recovery high schools, there are faith-based programs, recovery Dharma, There is a recovery high school in Philadelphia. There's another one in Bethlehem, PA. Those are so far the only two recovery high schools in the state of Pennsylvania. There's a PHP program for under 18-year-olds in Malvern called the Center for Families. PAR is the Pennsylvania Alliance of Recovery Residencies. So that's a great website for finding really great sober living places that have been vetted, their employee assistance programs. So lots of ways to support recovery. And Judy's going to share these links in the chat with you. These are just some resources on our website. The Montco page has some information about their services. Our Pathways page has more information about some of those things I just mentioned. And then we have a support page that gives you some resources that are local, as well as our parent partnership meetings. These are meetings that are taking place through, well, mostly on Zoom right now. But this is just, you can barely see this, but this is our calendar of support group meetings for parents. So all of the green bars are meetings that are happening on Zoom. The purple ones are happening in person, and the red ones there's just one, and that is hybrid. But those can all be found on partnership calendar on our website. So I'm going to introduce you first to Neda Sultani, who is the Opioid Use Disorder Coordinator with the Office of Drug and Alcohol and Public Health at Montgomery County's Department of Health and Human Services. And then we'll get to the rest of our folks. So Neda, would you like to start sharing your screen?
Sure.
Thanks for being here.
Of course. All right. Thank you, Kim, for that introduction. My name is Neda Sultani. I am from Montgomery County. I have a unique position where I get to straddle both the Office of Public Health and the Office of Drug and Alcohol. I'm going to talk a little bit about how we help individuals access substance use treatment. Before we go too into this, let's get oriented to where we are location-wise. So we are Montgomery County, so location is very important to us. Unfortunately, we can only assist individuals who are Montgomery County residents. So that lovely red rectangle is where Montgomery County is. I don't know why part of New Jersey is hanging out there, but that's Montgomery County. Montgomery County is surrounded by Chester, Delaware, Bucks County, and Philadelphia County. We have about 828,000 residents, so we're a relatively well-populated county. So how do we function as an office? So the Administrative Office of Drug and Alcohol, we are within the Department of Health and Human Services under Montgomery County. We are primarily, or pretty close to 100%, not direct services. We contract with many wonderful providers across the county to complete direct services. So we really are kind of like behind the scenes. Our administrator is Linda Moore Singleton, who I think will be joining us soon. And the state, if you ever hear the term single county authority, that's the Office of Drug and Alcohol. It's just another way to name us. As far as treatment goes, we provide funding for uninsured and underinsured Montgomery County residents. We really are the funder of last resorts. You have to be a Montgomery County resident. The populations that are considered priority and get funding first include pregnant women who inject drugs, pregnant women who use substances, persons who inject drugs, overdose survivors, and veterans. We do a whole host of things across the spectrum. We have prevention, intervention, case management, early intervention treatment, and recovery support. So when an individual calls us, because a lot of times it's confusing to understand exactly what we do, we oftentimes refer them out to one of our providers. Say, for example, someone were to call they need treatment services. I usually ask them, okay, well, where are you located in the county? You don't necessarily have to go to the case management site that's closest to you, but for most people that makes the most sense. So these are our providers who conduct the assessments and determine what level of care an individual may need. So you can see that we are pretty well covered across the county. We have Aldersgate in Willow Grove, Marikey in Lansdale, Creative Health in Spring City, and Carson Valley in Norristown. And don't worry about like memorizing anything or screenshotting even, we can always get this to you later. And this is also on our website, these case management sites. So there's a whole list of possibilities of what might be determined treatment-wise. As you can see, we have withdrawal management, medically managed intensive inpatient, medically monitored inpatient, medium-high intensity residential, low-intensity residential, partial hospital program, intensive outpatient, general outpatient, early intervention, and medication-assisted treatment.
Hey, Netta, can I just say something real quick about this?
Sure, of course. Hi, Lynn.
So, hi, everybody. I don't know who's on the call, but I just wanted to really highlight the treatment part of it. We call this level of care. And if you've ever accessed or attempted to access treatment or have a family member who have attempted to access treatment, we actually changed the level of care. The federal government came through, and what they applied is called the ASAM. And that's just basically what we used to use for adolescents. In Pennsylvania, we used to have what is called the Pennsylvania placement criteria, and it was the PCPC. And so we changed it. So these names, the withdrawal management may not be familiar to you, but we used to say 3A level of care, 3B level of care. And so we just wanted people to understand that this is the same level of care. We just changed it to a different model.
Thank you. So recovery support, we do fund peer-based services to support and assist recovery. Many of you may already be familiar with certified recovery specialist or certified family recovery specialist. They can support you in many, many ways, basically lots of ways that are not medical, right? So if you need help finding a job, or you need someone to talk to, or, you know, there's a whole host of ways that they can be helpful. We partner with, and they will be speaking soon, so I won't speak too much on their behalf, but we have these services available through Montgomery County Recovery Community Center. I'll speak a little bit about some of the overdose prevention efforts that we have in the county. There is a lot going on. So we have something called the Warm Handoff. All 9 hospitals in Montgomery County are linked with a Warm Handoff partner provider for engaging and referring individuals to substance use disorder treatment and support, right? The hospital is really for acute care, and we want to cover people after that as well. Since the program implementation in 2017, we've had 439 individuals have been referred to the program, with 149 accepting referrals directly from the hospital. We do have a Narcan education and distribution program. We've established a mail-to-home program in partnership with Next Distro. And these numbers probably need to be updated. I think this is probably a little bit higher now, but since April of 2020, about 302 kits have been requested and shipped to Montgomery County residents. And I'll throw the website in the chat after I'm done talking, but we do have a website that explains all of this, exactly how to access Narcan if you're an individual, how to access it if you're an organization. Again, Montgomery County Recovery Community Center, awesome partner. They do all kinds of educational events, and one of them includes naloxone or Narcan training. We've had a couple drive-through events with Narcan. We had one local grassroots organization, Proact, who had a drive-through Narcan giveaway event, which was awesome. We also fund homeless outreach services conducted by Access Services. Outreach staff provide education to individuals on how to access SUD treatment and support, as well as medical care through the county health clinics as applicable. We also fund mobile engagement services in partnership with our Office of Children and Youth. Through the SCA, we contract with Penn Foundation. We are actively involved in plans of safe care coordination. And a plan of safe care, in case you're not familiar, is a plan that's designed to ensure the safety and well-being of an infant who may be prenatally exposed to a substance following their release from the hospital. So it really tries to help wrap around what the mother may need, what the infant may need. You may have a nurse that comes to the house to visit. And some additional partnerships that we have, our Office of Drug and Alcohol. We partner with our Office of Public Safety to oversee requests for accessing Narcan. We do have an active overdose task force working group. We are a part of the Regional Overdose Prevention Coalition, which is pretty exciting. That encompasses all Southeast counties. And we have a partnership with the District Attorney's Office and Law Attorneys General Office in establishing the Law Enforcement Treatment Initiative Program, which helps to, instead of criminalizing substance use disorder or arresting an individual, if an officer sees that, they really need treatment, they can refer them to treatment. Right. Lastly, some contact information here. Really, our gurus of treatment are Linda Moore Singleton, our administrator. Again, I can throw these things in the chat as well. And Vicki Junkowski, our DNA coordinator, both wonderful resources. And that's it for me. Thank you.
I am Silvana Matzella. I am the Associate Executive Director at Prevention Point Philadelphia. Thank you for inviting us and having us. I will be upfront, as many of you may probably know, we do not provide services directly in Montgomery County. We are Philadelphia based. We have a number of programs which I will go into, but we do definitely not only work with a lot of individuals, including Neda Sultani and others in Montgomery County, but we also, unfortunately or fortunately, end up working with a lot of individuals who come from Montgomery County to Philadelphia in the throes of their addiction. They either come to meet someone or to buy a substance and end up getting kind of what we call trapped in Philadelphia and trapped in Kensington. And then they come to us sometimes for help getting back home to Montgomery County, or getting into treatment in Montgomery County, or getting into treatment in Philadelphia to kind of get themselves whole before they can go back home to family. So we end up interacting a lot. I think I actually heard this from you, Kim, many years ago. And if not, at a conference that you and I were at together, this concept that it's chemistry, not character. So I'll just talk a little bit about harm reduction and what we do, which is really thinking about the chemistry and biology of substances and thinking about a person-first approach, meeting people where they are to help people get in the door. And that's really what I like to think of as harm reduction.
Silvana,
Yes.
sorry to interrupt you. Could you click on you're not when we're seeing your sidebar. So if you can click on from current slide at the top, near the top. No, you don't have to do that. Just at the top left. Yeah, that's fine. Then just go ahead and advance your slide once you.
Sorry, I
There
tried
you
that.
go.
Sorry.
Perfect. No worries.
Okay, so harm reduction is many things, but one of the things that we do is reframe addiction to an approach where we meet people where they are, wherever they are in the continuum of drug use. And that can be from actively using or starting use to being in recovery. And so just some kind of precursors that I always like to remember and that we always think about is that, yes, there are definitely people who use drugs by choice despite negative consequences. There are also many people who don't use drugs by choice and did not enter substance use by choice. And that's one of the very sad things I always hear about, people that started their addiction through sometimes a parent, a relative, an older partner. Regardless of where people are in their drug use, either willingly using substances or in a lapse or relapse, I have never met anyone who willingly chose addiction or chemical dependence. It is a misnomer that most people come to addiction through trauma, but for many people, trauma is the entry point to addiction. And that being said, addiction is also traumatizing to the individual, from the physical effects of addiction to being unsheltered sometimes during addiction, to what happens during addiction, to self-shame and stigma, et cetera. But we also recognize that addiction is traumatizing to the people that help people, who love people, could be family members, parents, partners, or those of you who are in a helping profession, who by caring for the people that you help, getting into treatment or providing treatment, are also traumatized. Harm reduction recognizes that there are real harms to substance use, but that despite those real harms, some people are still not ready when they come to us. Some people will be ready, just not today. Some people will never be ready. And so the harm reduction approach is one where we are working with people engaging in high-risk behaviors, particularly drug use. We want to provide low barrier services. We want to provide judgment-free services. And what I like to think of is the open door approach, or what you hear of the no wrong door approach. We want the door to be open. We want it to always be open in multiple parts of your buildings and services and homes and hearts, so that people will come back in and out of that door as they need to and never feel like they cannot return. So we do have participants who have gotten 8 treatment referrals this year. We never stop giving the 9th referral, because if someone is asking for help, that door will be always open. And the other thing I like to think about with the harm reduction approach is that we are accepting people who, where they are right now. They might be saying no to us for treatment sometimes. They're not always saying no, but when they are saying no, we are hoping that one day they convert to yes, or maybe. There are always going to be people who say no. I see many people every day in my work that there may not be a yes for treatment, but there will be a yes for food. There will be a yes for case management. There will be a yes for medical care. Or for counseling. And even those people that always say no, we want to keep those alive. We want to keep them alive. They are, in fact, the people that are most at risk. Just a continuum of harm reduction. It's a menu of services. It is not something that everyone can always implement in their programs, but all of you are involved in overdose prevention and naloxone distribution. There's community first response, including training people in the community to reverse overdoses. There's MAT, as was talked about, peer-based recovery. We also employ certified recovery specialists. specialty wound care. So this includes wound care for wounds that people get from substance use, but also HIV care, hepatitis C care, PrEP. Testing and linkage to care, most definitely. Medical case management for medical conditions and for harm reduction. We also do homeless outreach, and we are one of Philadelphia's homeless outreach teams. Drop-in centers, access points. Recently, a lot of counties have taken a stance around fentanyl testing and made fentanyl distribution legal. And then PAD, LEAD, and LEDI programs, so basically diversion programs that where someone might be arrested for a substance use related offense or theft or sex work charges, and they, instead of being arrested, are offered substance use treatment, or in our case, an assessment and referral to services, which can include substance use treatment. And then most definitely syringe service programs, which we obviously are one. So in terms of, I think, maybe less tangible resources, I will, was asked to think about ways that we can support people who are either care for people who are in addiction, or who are working with people struggling with addiction. And I think in terms of serving people with addiction, one of the things that I always think of in my work and in my shop is that people have so much to teach us about what they are going through, about how to engage them in care, about how to provide quality care, about how to make treatment possible, and how to make change in your life possible. Someone may be coming to you today and they don't want treatment, but we can offer them whatever else they're presenting with and ask us for help with, if it is in our possibility to do, and if not, we can refer them elsewhere. To always assess for people's medical needs and to try to provide care, to always assess for people's social needs. People have tremendous impacts from their addiction in their social lives. And so, without judging them, we can offer services. And to always, where people are talking about taking medication, to talk about adherence, and to always try to support people to be in care. We hear from many providers, well, how can we prescribe people Hep C meds? Or how can we prescribe HIV meds? Or how can we prescribe this if people are still lapsing or relapsing or not fully stable? And in fact, people can take medication. And that is another way for us to tell people that we care about them. We want them alive. We want to care for them. And to always look for strengths in people. There are people that may not be taking care of themselves, but they are taking care of others. They are bringing other people for care and for treatment. But there are limitations to serving people and the harm reduction approach, including that sometimes, we offer too aggressively drug treatment or something else, and we have pushed people out the door. Sometimes we don't offer aggressively enough. It is I think very troubling sometimes to see people deteriorating in their health, or their drug use gets exacerbated. And yet, the challenge is to still keep that door open and to always be welcoming. And sometimes we feel like we are doing the impossible for people because they are changing their mind every day about what they need. And we are going to still try to offer care. For those of you who are loved ones who are struggling, I want to just, kudos for hanging in there with people and for always providing support. We get asked a lot of times, well, what do I do? We get calls pretty much every day from parents who are looking for their adult children. And my son has called me asking me to send money to your mailbox. Should I do that? He's asked to come back home. And these are questions that people grapple with, but there's no good answers, but we try to encourage people to provide whatever help people are asking for that is possible to do, that does not kind of stretch your boundaries, to provide resources that are possible to provide. to support people's goals. Sometimes they're not goals that are always realistic, especially when treatment is not part of them, but we still try to support people. We try to help people with small steps, accomplishing 1 or 2 goals if they're not yet ready for treatment or for the full change, and to encourage and acknowledge any change. And, you know, many of us sometimes have to say no, and that's okay too. You don't have to say yes all the time. You can say no. You know, what feels right to help someone who is struggling with addiction today may be a different response tomorrow. But we try to support people too as they support those that they love through addiction. I've seen parents, I don't know if this makes it, you know, I've seen parents purchase Suboxone for their children. I've seen parents train their whole neighborhood to carry naloxone. I have seen parents and caregivers do things or talk about things that stretch their own ethical boundaries, and yet they did them to try to keep a family member knowing that they were loved, that they were cared for, that when they were ready, someone would be there to help them. And those are, you know, the struggles that many of you may go through if you are supporting someone who is going in and out of addiction. And, you know, it is okay to say no. It's also okay to say yes. And to, you know, most definitely, I would also say that you should all seek the support for yourselves too, because it is difficult. Some of our resources, you know, I think about some of the things that were referenced. We are actually an early intervention level of care, our drop-in center. We're not required to get people into drug treatment, but we do. We get hundreds of people into drug treatment every year, and we're required to report on that. We also are a medication-assisted treatment program. We are a 1.0 level of care for outpatient. As was referenced earlier, because we directly provide buprenorphine treatment, as well as naltrexone, Vivitrol, and Sublocade for the last 2.5 years. And we also are an ASAM level of care assessment center. So people come to us and they do not want drug treatment with us, but we refer them elsewhere. We also support people around stigma reduction. We have case management. We distributed 19,000 doses of Narcan ourselves last year. And we have a mobile unit that goes out and follows overdose surges and distributes Narcan and does induction on buprenorphine out on the street out of a mobile medical clinic. Most recently, I'm going to introduce Morgan Purcell, our harm reduction policy and data specialist. We, as part of the Regional Overdose Prevention Coalition that was referenced earlier, we have been providing technical assistance to Montgomery County, Bucks County, Delaware County, and Chester County through a Vital Strategies initiative to support the 4 counties in applying for harm reduction interventions and in considering other harm reduction interventions. And so each county, including Montgomery, has successfully initiated a harm reduction intervention in addition to what was already happening. And there's more interest in other things. So if it's okay, I'm going to turn it over to Morgan.
Yeah, I think I'll just echo what you said, Silvana. There's definitely some interest in more resources and interventions in Montgomery County, and some of the things that I've been helping to support through the grant that was mentioned. We're getting the LETI program up off the ground. So if anybody has any questions about that, I'm happy to connect to appropriate resources.
Great. Thank you both so much. Silvana, did you have anything else right now? Okay, well, if any questions come up for Silvana or Morgan, we'll keep an eye out. Claudia, would you like to unmute and share your, oh, can you stop sharing, Silvana, so that Claudia can pick up? And just as a reminder, we are recording this, so you'll be able to see this. And I believe I have everyone's permission to share your PowerPoint slides. We had a question about that. That's okay?
Yes. I did pause share. Is that okay, or?
It's still there, but I can maybe, if I can see that. Stop. I can stop your sharing. There we go.
Hey, there we go. Mine's not as fancy, but it will do. Well, thank you for having me today. Let me get back into my beginning. Okay, hold on, let me go all the way back. Okay, well, thank you for having me, Kim. My name is Claudia Herman, and I am the coordinator for the Montgomery County Recovery Community Center, which is located in Norristown. And we are under the umbrella of the Council of Southeast Pennsylvania. We are also known as Proact. Our approach is to meet people where they are, and I always say don't leave them there. And we utilize both peer support as well with certified recovery specialists and volunteers who have possessed and lived experience in substance use disorder recovery. And it's not going to behave itself, so I'm just going to have to do this myself. Why are you doing this? Let's see. Enter, okay. We provide recovery support services and we provide programming in our center. Our recovery support services are certified recovery specialists. We're peer-based recovery support, person-centered, strength-based, and community-oriented. Some of us both have CRS and CFRS. I am a CRS and a CFRS as well. I do not personally do direct service, but I facilitate groups and develop groups. So I work with the participants in our center very closely. Who can benefit from our programs? The Council of Southeast Pennsylvania CRS program services individuals living in Bucks, Montgomery, Chester, and Philadelphia. So we have a recovery center in Bristol off of Veterans Highway. We have Montgomery County on DeKalb Street above the District Court. We're on the corner of Marshall and DeKalb. We're in Chester County. We have an office there where we have CRS services, as well as our 17th and Lehigh Center, which is in Philadelphia. How can our recovery support services help? We match participants with certified recovery specialists who will meet with them regularly, usually once a week. We get most of our participants through referrals through the treatment facilities like Eagleville, Valley Forge, Malvern, Pyramid, but we do get walk-ins as well. We work closely with drug court, behavioral health court, as well as veterans court. Our CRSs will accompany and support participants through the continuum of care. We assist them in navigating community systems while helping them remove the barriers, which we know in Montgomery County: transportation, housing, employment, and aftercare, as well as reuniting families, etc., bringing them back into the community. We teach by teaching and modeling the skills necessary to enrich participants' quality of life while we obtaining and sustaining long-term recovery. And that's really part of the goal. And we meet people where they are. So they come in at different levels of recovery. And they vacillate between the 5 stages of change. We can get people who are coming in and they're pre-contemplative, they're contemplative, they're taking action, they're planning, and then 2 weeks from now, they could be back to contemplative again or pre-contemplative. And we're there to support them through this. The bottom line is it's peer-to-peer. So they're working with people who have that strong lived experience. So when we're with them, we put our hand out and we go, we know we've been there at some form and we understand. Let us help you navigate recovery. Because as I always tell everybody, recovery is not for sissies. It is a very difficult process to go through. And we want them to engage in our services so that we can help them navigate recovery and stay there. We provide many programs designed to support early and long-term recovery. So you've got the recovery support services side, which is our certified recovery specialist. And then I call it my side, where I provide programs, events, and meetings for people in recovery. Our programs are free to all individuals who register with our center and or engaged in recovery support services in our center. So we have programs that go anywhere from reentry, which is gateway to work, which is resume development. We do mock interviews. We teach them how to do introduction and thank you letters, job search. We have a good connection with second chance employers who hire felons, as well as we work closely with CareerLink. Every day I get information from CareerLink, and I'm always posting it with my CRSs. We do job searches. We do personal budget and finance, because when you're coming out of treatment or incarceration, some of those life skills you may or may not have. And we want to help you in terms of while you're navigating recovery, you need to develop these skills. We also do basic computer skills, Word, Excel, navigating the internet. And we also do, through the legal aid of Southeast Pennsylvania, we do expungement clinics. We can help them get IDs. We can help them to get birth certificates. If they come into our computer lab, we're open 8:30 to 4:30 every day. It's walk-in, open access. They can come into our center. We always have a peer volunteer there, or one of our CRSs or myself, and we will help them navigate all of this. We have 4 recovery centers in Norristown, and a lot of women come in and we help them to get their birth certificates as well as their IDs, which is a very big deal. We also do programs, topic support groups. And our topic support groups are medicated assisted recovery. We do a Wellness Wednesday and Refresh and Recover, where you come into it. These are all in-person groups. Some are hybrid. Wellness Wednesday is in-person. Medicated assisted recovery is hybrid. You can do Zoom, or you can do come into the center and be one-on-one and work with a group. Wellness Wednesday, we do meditation. We do all kinds of, we do tactile art projects, all centered around recovery. And Refresh and Recover is we try to show them how nutrition fits into recovery. So every week we create a smoothie, a salad, or whatever the case may be, so they can see how to pair nutrition with recovery, because that's a very big part of recovery and self-care. We do Beyond Trauma. It's a curriculum, and it's the women's trauma group. I personally facilitate that group. We meet once a week, and these are women who are both in recovery and have experienced trauma throughout their life. We do not deep dive, but the curriculum is really very good, and it's very tactile, and I can't wait till we're in person. We do Tackle It Tuesday, where we have a van and we can take people to different places. We go to the food bank one day. We can go to the Department of DMV one day, help them to restore their license, whatever they may need. We go to unemployment. We can go to CareerLink, wherever they need to get to as a group. We'll go up to Pottstown. We'll take a group, bring them back down to the center. So we're there to help them because transportation is a huge barrier. And we also use our Proact Calendar. So our Proact Calendar is topic support groups and meetings provided virtually and hybrid by all 3 centers. So in any given day, you can go online or you can come into our facility and you can access all our groups, whether they're in Bristol, Philadelphia, or in Montgomery County. So you have access to a wide variety of groups that you can tap into, which is great for people during COVID, which when there has been a lot of isolation. And this way you're connecting to people and engaging. We do meetings, we do Smart Recovery twice a week, and we do Family and Friends Smart Recovery every third Monday of the evening. I have calendars. I will have my email address at the end. Just email me and I can send them out to you. And we also do events, Adventures in Recovery. We get people out, we get families. My goal is to have families participate in Adventures in Recovery, where families and individuals are getting together, having fun, engaging with other people in the recovery community. So we do hikes, disc golf, we do art in the park, and we're doing a participants day at the zoo, Elmwood Park Zoo, for our participants. They get free passes and lunch, and the zoo actually donated those to us. Our contact information is 601 DeKalb Street. We're on Suite 1 upstairs. Just have to ring the bell. We're in Norristown. You have our main number. There's my phone number and my email address. So if you have any questions or you're interested in any of our services or you need resources, please contact us. Contact me. I'll be more than happy to point you in the right direction.
Wow, thank you so much. You're all doing absolutely amazing work. I mean, I don't know how to thank you enough for everything that you do. Claudia, and actually this is, I would love for us just to have a conversation about how COVID has really impacted and I know you've all touched on it a bit, but how has that looked? And maybe if you can share some without disclosing any confidential information, obviously, but like some stories that you can share with us about how some challenges you've seen, but also some positives you've seen through all of this, what some of these challenges have looked like. Go ahead, Claudia.
I'll start. I've seen the positive I've seen is access to programming, access to certain services, even if it's telehealth. People because transportation is a huge barrier. And in a lot of people cannot get from Pottstown or Glenside or Abington into Norristown. So the ability to go on Zoom and still access those services and access that programming and be able to engage with other individuals in the recovery community is huge. And without the Zoom, without the virtual platforms, they would be in isolation, and this has kept them out. And also, when we first started last year with COVID, I became that triage person for drug court. So when people were just entering drug court and it's all brand new to them, the POs would give them my number and I would talk them through until we could get them placed into recovery support services, which made a huge difference because that time frame, they are very fragile and they could have, in isolation, you don't know what they would have done. So what I found was a lot of people have said to me that they were so grateful for all the virtual services. At the same time, because we're in that weird place right now, we get people to come in, people feel funny, they're not sure, do I take my mask? What do I do? Do I want to be in a group? Do I feel comfortable? And I think that comfortability is still out there and people are not sure how to navigate it. And yeah, there has been a lot of relapse, overdoses, and even with our own participants, losing track of some of them, or they kind of fall off the system because they'll text with you and but they're not really engaging. They don't want to be on the phone and they don't want to be on Zoom. And it's their way of kind of isolating themselves. So that's that downside of it that we see in our center. Long-winded.
Yeah, I know. I appreciate that. And Silvana, any thoughts that you have about that? And I'm also wondering too, either of you or any of you to talk about, we know that there are Zoom meetings and there's online therapy and all that kind of stuff, but not everybody has access to internet and Wi-Fi. So what about some of those challenges too?
Yeah, I think, the data says that we did see an increase, unfortunately, in overdoses. And what was touched on, increases in relapses and lapses. What we heard from law enforcement, for example, was that there were changes in the supplies, right? We know that there are more people coming to coming to fentanyl through other substances. They didn't intend to use an opioid. We know that there are people that are using what they think are pills and maybe not what they thought was an illicit substance, even if they did get the prescription through someone else. And those pressed pills also have fentanyl. So, we saw an increase in people being affected by overdose. We also saw social isolation, and for all of us here that do overdose prevention education, where we are giving someone Narcan to save a life or for them to tell someone how to save their life. When you're telling people to social distance, they're not around people to save their lives in the same way. And then to your point, I know we are quite different in Philadelphia, but there are still unsheltered populations in Montgomery County and everywhere else. We did see both huge challenges to getting people, telemed was actually great for us, and we are still doing telemedicine for those individuals that can do that. For a lot of, at one point, the majority of medical visits were telemedicine because our providers couldn't come in, but the majority of case management visits were still in person, right? Because people don't have phones or computers in a lot of our populations. And so they were still coming to us, doing services from a door, or, we had several weeks early on in COVID and last summer where we could not find a pharmacy that stocked buprenorphine, right? So that was a real issue, at least in Philadelphia, but we've heard of similar challenges elsewhere. And, you think about the Department of Behavioral Health, the health department, and other providers. A lot of people that were also giving out Narcan were no longer giving out Narcan because they weren't in person. So there were all those added burdens. That being said, I agree, a lot of strengths. We had people that do have access to a smartphone who said it was the first time they were ever going to a meeting because they didn't have to face someone. We saw many more creative types of meetings for people that don't like the 12-step model or something religious. They were able to find something else. I also, will just say, I saw so much resilience, especially among unsheltered people, and I saw so many more people that maybe never, made food for people come out and give food, come out and try to minister to people, come out and try to help people with things. There's a lot in Philadelphia that DBH has staff at that we do a meal for 600 every day, and there were volunteers every day. There were city staff that were not coming in person, but were volunteering. So I think there are so many bright spots when something this terrible happens. But there's, there were also people that couldn't get into their methadone clinics because staff were not showing up. And so I also saw people that were in treatment kind of clinging on to treatment, doing whatever they could to stay adherent, which was also good. So there were so many bad things, but what we learned about helping people, about breaking down a barrier to get treatment, let's not go back to what we did before COVID. Let's not go back to gatekeeping drug treatment and making it almost impossible to get. Let's not go back to, so many barriers that we removed during COVID.
Yep. Great point. We had a question, and Sandra, if you want to text me back and let me know if you want me to unmute you there so that you can ask your question directly, because I'm not sure I have it exactly right. You're asking, are some of your population parents, and could districts, I assume she means school districts, be helpful? And I'm not sure if the population, are you talking about the population that needs the services, or are parents, or they have young ones who need services. And do you guys partner? Okay, here, I'm going to go ahead and allow her to talk so she can ask her question. There you go, Sandra. And make sure you unmute. There you go.
Okay. Can you hear me?
Yes.
No, I'm just asking because I'm a kindergarten teacher, and I see lots of this, and I'm wondering, do you guys partner like with districts and like, parents that are struggling? Do you help them here? If that makes sense.
So you're encountering parents who themselves are struggling with a substance use disorder,
yes.
and
yes.
need treatment, and
yes.
are like their employers connected so that they can have access.
Or even they reach out to us, and we have social workers and guidance counselor, and
within your district. Yeah. Do you guys ever work directly with school district personnel?
We do, but I'm wondering.
Yeah.
Yeah, we do.
Yeah, I was asking these Claudia and Netta and even Lynn if there's any interaction directly with school staff.
We started with the IU, but we really haven't done much. I think it's a great opportunity to do that with parents who are struggling, and it's something to take a look at because it's real. Yeah.
We do have some services, and this is Linda. Hi, and we do offer not just SAP services, but if there is a parent who is seeking help and need treatment, we do give resources to the schools to be able to recommend and refer them. So yes, every school district should have information, and we have a website. So if you go on our Montgomery County website, there are a lot of resources for parents around the school districts.
Okay. All right. That's all I was wondering. Thank you.
No problem.
I see it. Yeah. Like I teach kindergarten, so I see it at a lower level.
And SAP services are a resource in the schools, not just for the kids, but for the parents as well.
Okay, great. Thank you.
Okay.
Thank you so much.
Thank you, Lynn. Here's a great question. Is there a place to get free Suboxone? My child is on Suboxone maintenance and will be visiting me from Florida for a week very soon, in case she loses her medication before she comes. Not available at no charge, is it? Unfortunately.
I mean, we get asked this too about our clinic. You can use 340B funds. So some of the clinics have that designation. They can reinvest into patient care. That's what you are supposed to do. So I will say that I think clinics can be a little bit more flexible. The lost, stolen medication problem is one that's not easy. We're very, we do it case by case. And if it hasn't happened at all or a lot, we will pay to refill people's medication sometimes. But I have found, that's hard to get approved in a lot of clinics. So, but again, I just, on the non-provider side, I know parents that buy Suboxone and, not only have it on stock for their children. I know a few parents in another state who share with other parents when their children are going through. I mean, people do go to amazing lengths, but no, I can't think of any, easy fixes for this one.
It's tough. Benjamin, would you like to ask your question?
Yeah, sure. Thanks. Good evening, everyone. This is for Silvana. I used to be a volunteer at the Step Up to the Plate mill site at Ruth and Clearfield.
Oh, thank you.
Yeah, I used to work with Roz and Clayton. So are you still doing that program?
We're still doing it. It's 600 meals a day at Step Up to the Plate, and we're going to be taking a little more responsibility for the other sites. I've helped serve a meal here or there early on in COVID, but not recently. But yes, 600 meals a day, every day at the lot on Ruth and Clearfield. Thank you for doing that. And that's what a few of the times that I went out there, there were DBH staff, there were city staff from different agencies, there were community residents that just wanted to be out there handing out food or doing something. So thank you for doing that. But we are definitely doing it. We have Narcan there every day. We have a benefits counselor. We have a case manager. So we have other resources there. And then there are other agencies that come out there and do other projects.
Sounds good. Like, so are you still working with Broad Street Ministry and CMAC?
Yes. Yes.
Okay.
Broad Street Ministry is also doing 600 meals a day, I think, on the City Hall apron. And then CMAC is doing a similar program in South Philadelphia.
All right. Sounds good. Glad to hear it.
And thank you for, I would be remiss if I didn't thank DBH IDS for all of their support for people who are entering recovery, but most certainly for Prevention Point. They fund our ID project. We help people get ID. They fund the overdose prevention program, our drop-in center, homeless outreach, the police diversion program, and harm reduction services.
Yes. Thanks, Silvana.
Yeah.
You guys are just amazing, all of you. You know, when Silvana and I were talking earlier, I was saying that, you know, so I'm mostly spending my time with family members who are concerned about someone, whether have ever even had any kind of treatment, or even before they're in. Claudia talked about the stages of change. They're still pre-contemplation. They're not there yet. So I guess I'd like to hear from any of you who have experience working with those family members in particular. What I was saying to Silvana is I always want to equip family members with something in their pocket that when their loved one says, I can't live like this anymore. Okay, we're ready to go. We're ready to get you somewhere right now. So, you know, what are the steps people can take? And based on, obviously, everybody's different, their needs are different. But detox, right? I mean, that's one of the first things, is getting someone to detox. And what are the steps to go through to find the right place? What do they need to be aware of as far as any coverage that they might have, those kinds of, anyone can talk about just what you would like every family member to know about those steps to get people where they need to be.
Well, I'll just say one thing, because we get this a lot, right? You know, for legal reasons, including HIPAA, generally people are not going to be getting someone else into treatment. They can escort them. We do get a lot of parents calling us, I'm going to bring my daughter down there, but can you arrange this? I have her social security. No, we can't do that, right? So I think one is being realistic with parents about what they can do. They cannot arrange treatment. You can't arrange treatment for someone who's not ready. And no one's going to give you the time of day when you try to do that without the person there being willing. I think, you know, yes, there's detox, but I loved those slides early on from Netta Sultani. There's all different types of models of treatment. For some people, inpatient detox, which is a misnomer, it's really putting people on, you know, titrating them down from something or taking them off of a substance and putting them on, you know, buprenorphine or methadone. There's that, but that's not for everyone. And for some people, you know, especially, and this is, I think, where we see our recovery specialists really super skilled. Like we ask people a few questions. Tell me a little bit about your life. Do you have pets? Do you have children? Do you have responsibilities? Yes, I'm caring for my 80-year-old mother. Okay. For a lot of people, 7 days inpatient, if you can get that, is not ideal. And that will be a turnoff to people. So offering the range of what is out there. There's also something that you can do every day. There's also something that you can do once a week. You can go once a week for a prescription. So just offering everything. I have seen parents, I've seen treatment providers, I've seen our own staff sometimes, you know, push one thing over another because that's what worked for that person, right? Or that's what someone thinks is going to get them off their feet. It's what that person needs, right? Is what's going to get them to the next stage. And that can change too. There are people that go to methadone 7 times and it doesn't work. And, you know, everybody they've talked to has said buprenorphine won't work for you given your habit. And then buprenorphine works. And then similarly, there's the person that tried a different thing and then they go and quit cold turkey next week. And so it's whatever is going to work for you. The other thing I would say is, that open door approach. Someone says yes today, they pack their bags, they go out to get a pack of cigarettes, and then an hour later they're gone for a week. And so you can be upset, but you are going to be there for people, because they might come back in 8 days later and do it all over again. And this time you do drive them there and they go through with it. And you never know when that's going to happen. So to be a patient, and to be there for someone without necessarily losing yourself in the process.
Go ahead, Claudia.
I second that. I always tell people they call on our hotline. And I used to man that info line a lot. And I would get a lot of parents who called. And I would say, first and foremost, the person, your loved one, has to be ready. You can't force them into this. And if they are ready, then you have to, first of all, get them assessed. And I take them through the process of assessment. Where to go, how to get Medicare, how to get the resources, look on the back of your insurance card, whatever the case may be. I ask them what kind of insurance they have, where do they live, what geographically, where they're at, et cetera. And then I say, you can they have to do it. You cannot do it for them. And I think that's where parents come from. They want so much and to do it for them, and they can't. Just like as CRSs, we don't do it for you. You have to do the work. So first thing I do is just listen to the whole story, and then try to direct them with the resources the best I know how. And I think that Silvana said it all. Yeah, you can only do what you can do. But I always say, never stop loving your child or your spouse or that person in your life. I offer them our family program, the family to come to our family program. I offer them to come to Smart Recovery, friends and family. I try to offer the family help as well, so that they can understand substance use disorder and how it impacts them. And I also talk to my participants who are in recovery, and I always say to them, you need to have I hope you have this level of awareness that you're getting all this support and your family's over here and they haven't quite made it to where you're at right now. So really you need to show generosity of support as well, because they're still reeling and you're getting all this help. And they need help too. So that part of recovery can be helping them get there as well. So that's my philosophy on it.
Yeah, I wanted to say a little bit of something about that readiness thing that you talked about, Claudia. And while I absolutely agree that they need to want recovery to really sustain it, my experience with our son was that he had no interest in going to treatment. However, we were able to, through an intervention, make it really clear that things were going to be changing if he wasn't willing to at least try treatment. And he had never been to treatment before. This was, our first attempt at getting him into treatment. So I think that we know families, of course, who've been through this just dozens of times and just trying to force them back in. And as you said, if they're not willing to do some of that heavy lift, because it is hard work, as you said earlier. But we did learn what we had to do to say, like, okay, here's what's going to be different. Now, if you're not willing to accept treatment, I can't have a front row seat for this. I can't keep, giving you shelter and food and watching you do this and having illegal substances in my house. We can start having some boundaries that might actually help to raise that bottom a little bit. What's going to get our loved one there faster, being comfortable in their use or being uncomfortable in their use. And nobody wants to see, I did not want to see my child in pain, because my fear was just, getting to me that if I don't protect him, he's going to die. You know, if I don't do everything I can to keep him safe, he's going to die. And that's what kind of cripples us. And then, you know, man, I was doing all the work for him, you know, and that wasn't working either. So he had to be, you know, so he had to be forced in one way or another or not. And if he wasn't going to go along with it, okay, that's your choice. I'm not going to kick you out, but you can't live here. I'll give you here's an address of a place you can live. I found this shelter. I found here's a Salvation Army. Maybe you could try out their program, but I can't keep going like this, you know? So sometimes that's where we have to get, and it's a really hard place to be. But, you know, we often talk about this as this disease is progressive, you know, and you can see the progression from that first use to I want it, I need it, I can't live without it. And the reverse has to happen to get into recovery, right? I can't live without recovery. And I need it and I want it to sustain it. But we parents get a new normal too. And we get progressive and we start doing some things that I'm driving my kid to get the heroin because the last time she went, I didn't see her for 2 weeks.
Yeah.
You know, and so it is a family disease. It really and truly is. It grips all of us.
You know what, Kim, I am a person in long-term recovery, but I am also the sister of a brother who passed away from an overdose and a nephew who's still in active use, and his mother who has not come to terms with this and who just suffered another overdose. So I come at it from both sides of the fence. And there are days where I just go, if I had all those answers, wow, how wonderful would that be? I even tell parents, each case is different, each child is different, each person is different. I went into recovery and made that decision, and that was it. But not everybody does that. And I used to yell at my father for enabling my brother. But then I realized it's not enabling as much as I love you so much. I don't want you to experience anything horrible, right? Short of going into the Sunshine Motel in North Philadelphia to pull my brother out. So yeah, I understand both sides of it. And I tell that story and I tell my story so that they do understand that I understand both perspectives of it. It's a really tough situation.
Absolutely. Yeah. I don't see any more questions coming in. I don't think if anyone has anything else they would like to add, or if anyone has a question, please share that with us now. But if I don't see anything else, I guess we can say good night, and I will be posting this as soon as the recording finishes processing. So that page will be updated certainly by morning or late tonight. But I really want to thank you all again so much for all the work you're doing. We will share this recording so that we get people these resources. Claudia, if you can share your PowerPoint with me, that way I can post it because you've got all that great contact info on there. And I have, and Netta, yours as well. Yeah, I have Silvana's, but Netta, if you can send me your PowerPoint, that would be great. So folks can see that and we'll have a recording. So thank you all. Thank you for your work. Thank you for being with us. And thank you to everybody who joined us this evening.
Thank you.
Take care, everyone.
Thank you, Kim. Good night.
Good night.